My name is Camryn Berry. I'm an FD patient, and I am also an FD researcher at Boston Children's Hospital under the leadership of Dr. Jamin Upadhyay. Today I'm presenting our research into the diverse appearances of craniofacial fibrous dysplasia when imaged with CT, MRI, and sodium fluoride PET-CT. These imaging techniques are critical for detecting and predicting growth in FD lesions and any cancerous transformation or cystic formation. When an FD lesion is imaged with CT, it can have a wide array of presentations, including a ground glass, lucent, or sclerotic appearance, or a mixture of two or more appearances that correspond to the density of that lesion. When an FD lesion is imaged with MRI, it can also have a diverse range of presentations that depend on the type of MRI being used. Sodium fluoride PET-CT quantifies bone activity. In this study, our goal was to use these different imaging techniques to identify patterns within a group of patients with craniofacial FD lesions. We aimed to investigate any properties of the lesions that corresponded to symptoms such as headache frequency, pain severity, and sensitivity to light and touch. We also wanted to compare the appearance between MRI with contrast and without contrast. 15 patients with a total of 35 craniofacial FD lesions were enrolled in our study from 2021 to 2022. Patients were evaluated with CT, MRI, and sodium fluoride PET-CT. They also supplied information about their pain, where it is located, and how severe it is on average. The images were then reviewed by radiologists and a nuclear medicine physician who identified 5 distinct categories of craniofacial FD lesions based on density on CT, signal intensity on MRI, and bone activity on sodium fluoride PET-CT. The first category were lesions with high bone activity, an intermediate signal intensity on MRI that's similar to skeletal muscle, and a mixed appearance on CT. Figure 1 depicts the sodium fluoride PET-CT, 2 different types of MRI, and CT images for a patient that just so happens to be me. My craniofacial lesion is located in my left cheek and falls under Category 1, which was the most common, with 37.1% of lesions falling under this category. Category 2 identified lesions with high bone activity, a low signal intensity on MRI, which could correspond to a lower bone density, and a mixed appearance on CT. Category 3 identified lesions with low bone activity, low signal intensity on MRI, and a sclerotic or lucent appearance on CT. Category 4 identified lesions with low bone activity, an intermediate signal intensity on MRI similar to skeletal muscle, and a lucent or ground glass appearance on CT. Category 5, which was the least common category, identified lesions with a low bone activity, a signal intensity similar to fluid on MRI, and a lucent appearance on CT. Lesions in Category 5 most likely are cystic in nature, which is identifiable by that fluid-like appearance on MRI. Figure 2 depicts a patient with a lesion at the back of the skull that belongs to Category 5, with the yellow arrows indicating that cystic region. Figure 3 shows each patient and where on the front and the back of the head and neck they experience pain. When the pain frequency and severity of patients in each of the 5 categories was evaluated, no patterns emerged. However, there was strong evidence that FD lesions in the temples and base of the skull correlated to more frequent pain and headaches. Figure 4 depicts 2 different types of MRI imaging before contrast on the top and after contrast on the bottom. The images without contrast were satisfactory for identifying different subregions of a lesion, which is shown in the upper right image with subregions that appear brighter corresponding to lower bone density in those areas. In conclusion, we were able to identify 5 different categories of craniofacial FD lesions using a combination of different imaging techniques. These categories did not correspond with pain symptoms. However, lesions in certain locations, such as the temple and skull base, correlated with high frequency of pain. Contrast use in MRI imaging did not provide any additional information on lesions or their subregions. This was a preliminary study that provides a foundation for larger studies, especially ones over a larger period of time, that could be used to predict lesion changes in patients with craniofacial fibrous dysplasia.